Good afternoon to all of our panelists and everyone joining us today. Thank you so much for being here for this very dynamic conversation that's going to be talking about responding quickly and efficiently to support our Latino essential workers, those that have been so very impacted by the COVID-19 pandemic. Many of you know HIP for a long time, some just a short time, but what you do know is that we have 4 decades of working in Latino communities across the Americas to strengthen leadership, influence, and equity. We're doing this with a focus on social justice, on racial justice, and on shared prosperity. For us, this means not just having long-term programming to address all of these systemic challenges, but also the capacity to move really quickly to support Latinos when crises like the COVID-19, like the hurricanes that just happened in Central America, when those hit, because we know that those often have disproportionate impacts on our communities. And COVID, like all these other crises, has particularly hit our communities really, really hard. And the impact on essential workers, on farm workers, on Latinx workers has been beyond words. Couple numbers, the latest numbers that we're seeing as of November is that the United States, as you all know, we're experiencing record highs for single day coronavirus cases, and Latinos continue to really face a disproportionate number of those cases. In Oregon, which is 13% Latino, Oregon is seeing that Latinos are making 32.6% of COVID cases. In Washington State, which is 13% Latino, they make up 36% of COVID-19 cases. California, many of you are from California, 39.3% Latino, and we are making up 58.8% of COVID cases. These are numbers that just shatter any kind of like thinking about what the world should and could and is looking like. And what we're seeing is for so many reasons, but it's what we know for a long time. We knew this was going to happen in March because Latinos have low access to health insurance, to their own personal cars. That restricts their access to being able to isolate. It restricts their access to testing. Latinos are disproportionately represented in jobs that have been deemed essential. These are jobs like food processing, meat processing, poultry processing, agriculture, transportation, retail, construction, childcare, healthcare, janitorial. It just goes on and on. Not only are these jobs that are essential to us so that we can eat and live and survive, but these are also jobs that sit at the bottom, very, very bottom of the wage ladder. And often coupled with that, they have few, if any, benefits. Immigration status amplifies this vulnerability as well. And so our essential workers, those that are in mixed status or whatever, are undocumented, they're excluded from federal relief, and they just don't have the luxury of not working. So having seen this path and having seen what was going to happen and looking forward, the impacts early on, hearing from our partners and allies, and understanding that something had to be done, HIP established the Essential Fund. And we did this with the generous support of allies like the Blue Meridian partners and many of the panelists who you're going to be hearing from next. We're joined by friends from the Alma Foundation, the Hartford Foundation for Public Giving, the Fundación Ángel Ramos, Julian Grace Foundation, and so many others who had the vision and the flexibility to really step up and come to work with us when the responses were needed, and we really knew that it needed to be multifaceted and quickly managed. We are grateful for all of your support. We are grateful for your deep and courageous work, and that of our grantee partners, over 100 grantee partners from across the country in 34 states, in Washington, D.C., and in Puerto Rico as well. So with that, thank you again for being with us today. I'm really excited to hear about the work that's going on the ground. And I'm going to pass it over to Meg Evans, Director of Strategic Portfolio Initiatives at Blue Meridian Partners, and recently wed. Meg.
Thank you, Anna Marie. It's a pleasure to meet you all. My name is Meg Evans, and as Anna Marie mentioned, I'm a director at Blue Meridian Partners, and I led our COVID emergency response efforts through the spring and summer. And just as context for those of you who I haven't had the pleasure of meeting yet, Blue Meridian Partners is a philanthropic model that brings together 18 different philanthropists, including individuals like Mackenzie Scott, families like the Balmers, and institutions like the Bill and Melinda Gates Foundation, who have all together pooled capital in the effort to address systemic inequities and the injustices they create. So what that means is we find and fund solutions to issues that limit economic mobility for young people and families trapped in poverty. And so we support social sector leaders on everything from unplanned pregnancy and early childhood education to workforce development and criminal justice reform, as well as place-based and local change. So at the outset of the COVID crisis, we felt we had a responsibility to act quickly and to support the communities and workers that we knew were going to be and continue to be, as Anna Marie has said, the hardest hit. And we were particularly focused on Black and Latino families. And so we had three guiding beliefs in this effort. The first was that we had to act quickly. So that meant no grant applications, no long due diligence processes. We wanted to minimize the burden on organizations who we knew were already working at full sprint. And we wanted to do so, and we did so in a way that stayed true to our own core, which is identifying really strong organizations with a track record of success, like HIP, who have the vision and pathway for impact. And the second principle was to partner with others. So we knew that we weren't in a position to do local grant making around the country, and we needed to find incredible folks who would be pathways and who had deep relationships in communities. And the third principle was we needed to trust social sector leaders and community members to know what they needed best. And so that belief led us to fund and focus on how do we expand access to cash as quickly as possible for families. So families know best if they need money for rent or food or laptops for learning, and we really wanted to get out of the way and give folks money to do with what they needed to do in this moment. So we did that both through direct cash assistance, as well as some funding in expanding public benefits like unemployment insurance and pandemic EBT and SNAP and others, the stimulus checks, recognizing that represents exponentially more money than philanthropy alone could provide, but also recognizing, as Anna Marie has said, that there are folks excluded from those programs, and they were designed to be difficult. So since April, we've allocated over $150 million to 23 organizations who support a variety of communities. So we've had focused funding in Black, Latino, and Indigenous communities, and a variety of type of workers. So we've partnered to support domestic workers, restaurant and other tipped workers, those in the gig economy, and importantly, as we'll hear about today, farm workers and essential workers. So I'm proud to say that now the majority of that 150 million is in the hands of families around the country. And we were only able to move quickly because of incredible national organizations like Mission Asset Fund, National Domestic Workers Alliance, Family Independence Initiative, the Native American Community Response Fund, BET, and the United Way, and many others. I could sit here all day and talk to you about the incredible work that people are doing around the country, and particularly HIP, as we're here to hear about today. And it's because of the deep local relationships with community partners, as we're about to hear today, who quickly built the infrastructure that created avenues for national philanthropies to support. So we are incredibly grateful for this work, and I'm eager to hear from my fellow panelists about their lessons learned and their work. So thank you for having me, and thank you all for your work. Everyone on this call, just seeing who's in here on the chat, it's a privilege to be with you all. And I will hand it over to Hilda to take us to the next part of.
Thank you so much, Meg, for everything that you and Blue Meridian Partners have done to support BIPOC communities, to support Latino communities, and especially to support essential workers to be able to get through this pandemic. I'm going to transition now to a conversation that we'll be listening to between Dolores Roybal, who is the Executive Director of the Con Alma Foundation, and Marcela Diaz, who is the Executive Director of Somos, Pueblo, Unido. They are partners in the Essential Fund and have worked together to really think about the impacts and the responses that they could provide in their home communities in New Mexico. And we are just excited to have them join us talking about their work together. So I'm going to hand it over to them. Thank you.
Thank you all. And, you know, one of the phrases that we hear a lot of nowadays on all of these Zoom calls is to, you know, don't forget to unmute yourself, right? So as the prior speakers have said, we know that people of color have been disproportionately impacted by COVID. New Mexico is largely comprised of people of color. Around 50% is Latino. And so we have seen firsthand how that's affecting our people and communities. Con Alma Health Foundation is a health equity organization serving the state of New Mexico. And we have had the very good fortune to partner with Hispanics in Philanthropy over many years. And this is just another example where we are able to pivot, take advantage of that relationship that we have established, and really do something together in terms of shared goals. Con Alma received a $500,000 grant from the W.K. Kellogg Foundation for COVID relief for immigrant communities in New Mexico to address both short-term relief and long-term recovery efforts. This Kellogg grant has a $500,000 matching grant component. Con Alma received a $50,000 grant from HIP's Essential Fund, which was used to help reach this match. This goal, again, a shared goal, is relief for immigrant communities to establish a fund providing immediate direct assistance to immigrants affected by COVID, but unable to access federal and state relief, and to create awareness about the structural barriers to their well-being. One of the project's main focus is essential workers without essential benefits. Part of the HIP's Essential Fund grant, $30,000 out of the $50,000, was awarded to Somos Pueblo Unido. And this is for the work with advocacy partners to create a statewide emergency cash assistance program for immigrant workers and families, and to advocate for local and state policies that would ensure access to government-sponsored economic assistance. This $30,000 grant was more than matched by Con Alma to a total of $35,000. $15,000 was from one of our other funding partners, Hispanic Federation, and Con Alma put in $20,000 for a total of $65,000. So although HIP could have awarded Somos a $30,000 grant directly, they had the vision, and I certainly credit folks at HIP for this, in terms of working with Con Alma and partnering with us. This not only doubled the amount that went to Somos, but it also tied it into a larger network here in New Mexico working on these shared goals. So some of the other activities related that this grant allowed access to is the grant making that we have done to other organizations around the state. And also we created an advisory committee of which Somos Pueblo is a member of. Those activities include supporting this public-private collaboration for state disaster relief, as well as developing a report to identify barriers to immigrants' well-being, and also to policy recommendations. So this work will continue beyond the scope of the grant. In summary, our approach for rapid fire funding strategies in a pandemic is simple. It's to partner with others with shared goals and values, to leverage resources and support those people, organizations most impacted. That's a core value for Alma, and that is community self-definition and community self-determination. One example of this partnership is with Somos un Pueblo Unido, and I will now turn it over to my colleague and nonprofit partner, a leader among leaders, and the executive director of Somos un Pueblo Unido, Marcela Diaz.
Hi everyone, thank you Dolores. I really appreciate that background. Hi, so just quickly about Somos un Pueblo Unido to get a sense of who we are. We're an immigrant-based organization that works to advance racial and worker justice. We've been around for about 25 years, and we organize in several communities throughout the state. We're statewide and do work both in urban and rural communities so we're really able to bring to the fore some of the major issues that Latino workers, essential workers, and immigrants are facing. And so we organize workers in their work sites and for local and state campaigns that would support and strengthen our communities. So as Dolores mentioned a little bit about the demographics in our state. We are one of the poorest states in the country, and due to the exclusion of mixed status families, 30,000 New Mexican adults, immigrant workers, and 38,000 of their children were denied more than $55 million in federal COVID stimulus rebates. And additionally, an estimated 16,000 low-wage workers without Social Security numbers were ineligible for unemployment or additional payments by the federal government through unemployment, missing out on more than $2 million per week. And this obviously hurts workers, Latinos who were throughout the pandemic facing major reductions in income and their families, as well as local economies, because that money was not being recirculated in our local economies. Of course, that hurts an inclusive recovery in the long term. We also worked as a part of, with a lot of the funding that we received through these kinds of initiatives on a statewide survey with Latino Decisions, a real strong partner of Somos un Pueblo Unido and many of our community-based organizations in New Mexico. And we did this over the summer just to help policymakers understand what we were going through as community-based organizations and what our members were going through. Often we need those kinds of reports to actually corroborate the story of our lives and what we know is actually happening in our communities. And that report was very sobering. It surveyed over 480 families, Latino families throughout the state, and it showed that half of those families didn't have in the summer more than $1,000 in savings to get them through the pandemic, and a quarter had less than $100 in their savings to be able to get them through the pandemic. So that's sort of the reality we were dealing with. Now, we have not been left out because lawmakers are jerks, although we all know that some of them are. But we know that lawmakers on both sides of the aisle at the cities levels, county levels, state level, federal level, didn't fight to include immigrants in economic relief programs that were so essential to so many workers in our communities. We were left out because we don't have enough power as communities. And so community-based organizations that work year-round to build power and engage in grassroots policy advocacy, we think we're best poised to act quickly, but also methodically and strategically to lift restrictions against undocumented workers and families in healthcare, relief programs, testing, all of the different ways that we are experiencing this health and economic pandemic. While the pandemic was certainly and is devastating, it also offered opportunities for us to continue to grow our base, recruit new champions and allies, develop deeper relationships with philanthropic organizations throughout the state in order to continue to lift what we know are racist and exclusionary and discriminatory policies that everyone sort of took for granted when it comes to sort of income support programs as well as unemployment benefits. And so that's what we're all working on now. In April, we co-convened a statewide economic relief working group of grassroots immigrant-based organizations to research, develop, design, and implement government-sponsored relief programs. And so we, while a lot of organizations with philanthropic partners were doing incredible work to help meet the immediate needs of families, we knew that it was important to think a little bit sort of more in the medium term of how we could actually create these systems that could outlive the health crisis, certainly be engaged during the the economic crisis that is obviously going to go on for at least a couple of years. And we really wanted to really figure out what was the best way of doing that. So we teamed up with philanthropic partners like Con Alma, and through the Essential Worker Fund, we're able to really kind of come up with and think through, again, methodically based on the dynamic process that we have with our community, how we could make state and local governments more responsive to our communities. So we, a lot of our organizations have honed our policy chops over the years. Economic relief programs are no exception. And so in this process, we were able to really identify some of the barriers and the needs of our communities. And I'm checking the time, I have 4 minutes. I'll get through quickly. So most relief programs, what we found, as I'm sure you're all aware, and I'm really glad that Meg talked a little bit about Blue Meridian Partners' efforts to provide cash assistance. It's really important in a state like New Mexico, because that's something that we really, really have been promoting with philanthropy, with local governments and state governments. What we realized, what we knew to be true, is that a lot of the relief assistance at the local level, at the state level, are going to businesses, which is fine and which is good, but not necessarily getting to workers and families. And so we also know that there were a lot of really good, important programs of food distribution, rental assistance, and other third-party payments. But those of us who work in the immigrant community know that our members in mixed status families and other low-income communities that might have, criminal records, or that may not have things in their names, that they don't necessarily have utility, phone bills in their names, and they have very informal relationships with their landlords. And so, people with really bad credit scores, for instance, might, we're creative people, so we figure out how to get this stuff done, and how to get these, but how to rent a place, how to have light and electricity and those sorts of utility services, but not necessarily in our name. So third party, which is a lot of feedback from our members coming and saying, look, my county is willing to pay 3 months worth of rent, my landlord's not willing to accept it. And so we really were trying to figure out what is the best way to get cash assistance to our communities. Another issue is that, most of the government relief programs, government-sponsored relief programs around the country at the local and state level are a hybrid between philanthropy and government money, which is great. And they rely chiefly on nonprofits to vet relief recipients and to actually distribute the funds. Now, in a state the size of New Mexico doesn't have the big nonprofits with the infrastructure large enough to be able to vet 30,000 applicants. We knew that here in New Mexico, the entity best poised to handle this was the state. In our case, our Human Services Department, and specifically our Income Support Division, because this is what they do. And so we really wanted to figure out how can we make them more responsive to our communities. So we helped design and develop as a working group local programs to pilot and test cash assistance programs through governments. And just recently, we're able to, in fact, on Saturday, launch a program with our state, with really responsive people at our department, our Human Services Department, with real leadership from a lot of the agencies that have been working around the clock to get services to low-income folks across the state. We were able to establish a $5 million fund with, that was CARES Act money to the state to actually give up to $750 to anyone in our state who qualifies, who did not receive the economic stimulus payment. And so this, we know, cash assistance, and I know Meg spoke to this a little bit, often proves to be the best way to help stimulate the economy, put money in people's pockets, and help families, because families best know how to use money to figure out what it is that they need. So now we're working with our philanthropic partners across the state, Con Alma certainly, that has helped convene with Kellogg this advisory group that we have to really, in this second or third wave of the pandemic, be able to help marshal philanthropic resources to really get directly to folks that are workers who are in most need here in our state. And so that's where we are right now, trying to create a parallel structure so that philanthropy can get cash assistance to people who've already been vetted by the entity that is the most efficient entity to vet people, and that is our state of New Mexico. So that's what we're sort of working on right now in developing with our partners as a result of the Essential Fund, and all of the leveraged resources that Con Alma has been able to put together in being able to move this forward. So those are some of the lessons that we've learned and some of the ways that we've been able to work together with government, nonprofits, most importantly, community-based organizations that have their ear to the ground and who can quickly identify problems with traditional relief programs and are in the best position to actually create those solutions. So that's what we're doing, and thank you for giving us an opportunity to share this along with Con Alma.
Thank you so much, Marcela and Dolores, for sharing your experiences with us, and congratulations on this huge win that you were just telling us about. That's a fantastic story. So obviously we all want to hear about all the hard work that folks have been doing this year. You're going to be able to hear more from Marcela and from Dolores now as we move into our roundtable conversation. And I want to introduce Jay Williams. We're very lucky to have him. He's the president of the Hartford Foundation for Public Giving, another one of our Essential Fund funding partners. And he is going to help us navigate the roundtable part of the conversation with other folks who are part of the fund and my colleague, Amalia Brendes Delgado. So Jay, thank you.
Well, thank you for the introduction. And I just am so excited to be a part of this discussion. All the work that is being done by HIP and other partners here in the best of times is critical. But when you think about the fact that we are facing dual pandemics, a COVID pandemic that has brought a health and economic crisis across the globe and across this country, and then the other pandemic of structural racism that has plagued this country for hundreds of years. This pandemic that we're experiencing has laid bare the inequities and the disparities that were so often talked about, and that were, as one of the previous speakers said, perhaps taken for granted. We had become, unfortunately, society had become accustomed to thinking, well, this is just the way it is, that these structural inequities have become so much of the fabric of the society that they were overlooked, but yet nonetheless detrimental to communities of color. So we're gonna have a roundtable. There are questions that have already started to come into the chat room. There are some questions that are being prepared, that have been prepared. So I want to take the next 30 minutes or so to facilitate a discussion. One of the things that, to start off with, that Marcela was just talking about was this notion of the public-private partnership. And I'm so excited to hear about the notion of actually putting that into action. I've spent considerable amount of time working in government at the local level, at the federal level. I am now in philanthropy, and when you talked about using the efficiency of the government to, and that's sometimes an oxymoron, the efficiency of the government, but in this regard, the efficiency of being able to vet individuals to receive cash assistance, and then having philanthropy come in and be able to provide that cash assistance. It's just a very exciting example, so thank you for the work. So to incorporate all of the partners here, Dolores and Heiny and Olga, Meg, and Amalia, really, I'm going to put some questions on the floor and ask you just to jump in and have a discussion around these. We will, again, monitor the time and also the questions that will come from our participants. But as we think about some of the biggest challenges, we'd ask you to share what are some of the biggest challenges that you saw impacting your respective communities at the start of the COVID-19 crisis earlier this year? And how did these impacts in their gendered and racial dimensions? And we talked about that and we heard that the data shows that the impacts are disproportionately and adversely felt by communities of color. How did those notions shape your response to better serve the communities when you think about the disproportionate impact of COVID? So I'll open it up to any of the speakers, and this is not a shy group. If I have to ask one of you to start, I'll do that, but please just jump in and share with us some of those challenges and how that helped shape and inform your response.
Okay, let me start. Thank you for this opportunity. I would like to share our experience in Central Falls, Rhode Island. We are in northeast of the United States. That's for us is the humanitarian crisis that was very critical. So especially in our community, because the 75% are Latin community. So we have the high infection rate that New York City, that was the peak. Our community, the low income, most immigrant, the people color, the population are considered essential workers. Many our residents are undocumented people. So we need to create many strategies and connect the local and state government to help our community and the health department. So we get considered, we change everything in our organization, our program, we change to do the really assistance, social assistance for our community. Because the people, there are many our workers that is in front the jobs that the people choose we continue the war or we continue in front the COVID-19 pandemic. So the people don't saving money because they get the minimum wage. So that was very critical. We push the government to get money for underground people because the people don't have assistant, federal and state assistant. We get money, the different foundation, different individual people for help the community. Thank you.
Thank you. And if you, as you respond, if you would just briefly introduce yourself and the organization you're with for those participants that may not be clear. Any of the other panelists, would you like to weigh in on again, how did how were your responses informed or shaped by the notion of the disparities around racial or gender impacts as you thought about this early in the year? And if you want to also then speak to how that perhaps evolved as we got deeper into this COVID crisis that I don't know, I remember when we left the office in March, we thought maybe this will be several weeks or a couple of months. And here we are in December, and it will likely not be, it'll be more than a year before we find ourselves back in the office. So, how did what you either anticipated early on or what you've learned subsequently help to shape or impact your response to this ongoing crisis?
This is Dolores, Alma Health Foundation, and one of our challenges was also an opportunity, as most are, and that is we are a population of color. We do have a large Latino population, but we also have expanded the definition of immigrant population to include other racial and groups such as our, Asian Americans, our Black community. And so I think by expanding that definition, and as Marcela was saying earlier, the efforts that Somos is leading and others are involved in terms of the state disaster relief are not just for immigrants, but they're for also low-income families. And so I think by broadening that, by helping people understand that they are us, that we are all part of the same community, that I think, has helped us to serve more people, but also to educate people about the value, the importance of essential workers and how those essential workers do not have essential benefits. And so again, I think it's, you know, taking that challenge and turning it into an opportunity.
Thank you. Yes, Marcela.
Yeah, I'm sorry. Go ahead, Amalia.
Thank you. No, I thank you, Marcela and Dolores and Heiny. This is so far such a rich conversation. My name is Amalia. I'm with Hispanics in Philanthropy, and I just wanted to add to the conversation as someone who was fundraising during the pandemic, and then also issuing support for organizations that we support across the U.S. And Puerto Rico as well during this moment, and then across the Americas. What we were seeing in this moment of rapid response was part of the reason why we exist is that we understood that the organizations that were closest to the ground, the most trusted community partners and leaders, were oftentimes the ones that weren't on the short list of foundations to go to when money needed to get out quickly. And so we wanted to make sure that those organizations were getting the funding in a moment of crisis, number one, and that number two, there was an understanding of who was being impacted the most as data was starting to come in and it was trickling in. I mean, now we have a lot of data to see the disproportionate impacts on our community and understanding of why that's happening, from, you know, immigration status, which we've been talking about, to disparities in testing and prevention and exposure, et cetera. And so for us, it was about making sure that we were getting to those organizations that were doing the work in places where there is high growth of Latinos, or we're seeing concentrated impact of COVID and food production plants, and in areas that were traditionally under-resourced and with low infrastructure. And so, and we had a lot of conversations with community foundations, like two of the ones that we have on this call now, and others, to see what they were doing and what the response was, who they were supporting. And so that was helping us also to gather that information in order to launch the Essential Fund, where we received over 350 applications, and we're able to make about 100 grants to organizations in 34 states plus Puerto Rico and the District of Columbia. And through that process, I think what we began to understand is some of what we're hearing now is that as the cash began to come into organizations, that they were receiving money to provide direct cash assistance for the first time for most of the organizations that we were supporting, that they were needing to not only pivot their traditional services to provide direct cash assistance, but then also figure out how to track that, how to do that without the operating support, because a lot of the money that was coming in wasn't with that support. And so part of what we were able to do as HIP, and thanks to the support of Blue Meridian and so many of our funders, was to offer some direct operating support to organizations in order for them to be able to not necessarily do it at a deficit, which is what we've been hearing from our organizations, and to be able to think about how do we sustain over time. And I think that for us has been one of the greatest challenges, is where the pandemic, I think people really optimistically wanted to think about the pandemic as lasting 3 months, and here we are seeing another incredible moment of that. And you know, I think that's part of the challenge, is where is continued funding. And like Marcela said, that organizations now have the data, they have the practices in place, they have the infrastructure, they're building the partnerships with governments, and I think the funding needs to come now in order to be able to sustain and support communities, so we don't see these numbers that continue over time.
Thank you. Marcela, were you going to say something?
Yes, I just wanted to pick up on a point that Dolores was saying about the ability to just co-inform our communities, right, about why people are left out, right? So it's not just immigrants who are undocumented, it's mixed status family, it's people that were super low income, that were under or unemployed, that weren't able to access unemployment. It really does provide, and our relief programs are not specific to immigrants at the city level. So Somos really worked with the city of Santa Fe to do a relief program that is really for lots of folks. Now, obviously 95% of the people in these positions are immigrants or mixed status families, and we're immigrant workers. But we, you know, and our partners, El Centro de Igualdad de Derechos, Voices, and other, and the Partnership for Community Action also did something similar in Albuquerque. Our other partners, Café which is Comunidades en Acción de Fe, in Las Cruces, also has its own sort of local economic relief program. And so we were really able to educate and inform policymakers about the realities of our lives as Latino immigrants, as people of color, but also be able to inform our own communities about other communities that are facing some of these dire circumstances as well. And so it's a real opportunity to build solidarity with, low-income people and people of color across lines. There was only one other thing that I wanted to add, and that is the case, as it is the case in most states, being in this pandemic, really, lots of things, it depends on your gender, it depends on your race, it depends on your status, it depends on your income, all of these things. But it also depends on whether you live in a rural or urban community. New Mexico is a tale of many different kinds of political, communities with different nonprofit infrastructure. So we organize in communities that are very conservative, but whose majority are Latinos and immigrants. And yet they're rural, and they've been rural, and they are dominated by a completely different set of politics in those communities. And not only do those cities and counties, they're not even asking for money from the state to give in any way, shape, or form to their families and their essential workers who are absolutely key to their local economies. But they also don't have the same level of nonprofit infrastructure that some of the other rural communities and other urban communities have. So New Mexico really is a tale of many, many kinds of cities and counties in their approach. And so that's in part why we wanted to create a statewide structure with a real eye towards how to bring in folks in those rural communities. How do we get, and you had asked Jay at the beginning of the pandemic, what were some of the biggest barriers? The city of Santa Fe, we have had since 1999 a strong sanctuary policy on the books. We've been improving it and strengthening it over 25 years. That is not the case in Hobbs, New Mexico, or in Roswell. And so when our city and government and state government officials were interacting and informing and giving information about COVID, about all of these relief programs, about philanthropy to familias, it was a different relationship with government than our members in southeastern New Mexico. So those were some of the barriers that we needed to overcome in just getting, and I know that there are questions about how do we get folks to trust the state? Well, it takes a lot of work, a lot of assurances, and in the spirit of power building and creating institutional changes that outlive the pandemic, it gives us a wonderful opportunity to move forward policy proposals that we've had in the works for a few years now to ensure the privacy and confidentiality of all of our information at the state level, which is something that we're taking to as Somos, our state legislature in the future. So we have assurances from our government that this information will not be shared with outside agencies, but it provides an opportunity for us to institutionalize that in the next legislative session.
Thank you. Thank you. Olga, you were saying something?
Yes, yes, thank you. I'm Olga, president for the Western Slope in Puerto Rico, and I would like to build on what Amalia recently mentioned, that sometimes organizations are not necessarily considered for this type of funding because of the nature of their services. In our case, we learned with Hurricane Maria in Puerto Rico that the only way for our communities to strive and survive during that tragedy was to reorganize our services, so we really became community service centers. In this pandemic, it was the same, and one of the challenges that we found is that because we're a direct services organization focused on education and in the after school space, we were not thought of as an organization that had the infrastructure and the reach in the community. So we do serve 13,000 families every year, so we were able to quickly react and understand those needs. So through the contributions like the one that we got through HIP, we were able to cater to those financial needs from our families, deviating completely from our current services. Another challenge that we found from the federal grants that we currently have is that while the federal government gave ample opportunity and flexibility to use the funds, at the local government level, those those flexibilities were not necessarily used to the benefit of the communities, but to the benefit of the government agencies. So I think that these are great lessons as to how to really understand the philanthropic work and the direct services work. How do we convene? And it's in the reach out to the communities, not necessarily on the core services that you provide. So that for us was a great learning on how do we really now document what we've done and make sure that in these circumstances like these that are more likely to repeat themselves, we're able to really transform our services and reach out to organizations that traditionally would not fund us due to their core focus.
Thank you. There's a question in the chat that I'll pull out. Evelyn from Boston gave an example that many bodegas don't qualify for state funds. Are there resources for them? And I'll respond very quickly. We recognize that here in the state of Connecticut, in Hartford, the Hartford region. We serve Hartford and 28 surrounding communities. And Hartford has a significant Latino Hispanic population. And the Hartford Foundation partnered with the city of Hartford and two corporations that actually created a $1 million fund for small businesses, particularly geared toward those small women and businesses owned by individuals of color that were, for a variety of reasons, not able to tap into the PPP programs. Either they were busy trying to keep the doors open, there were barriers, they had informal relationships, there were too many questions and things that just became a barrier. So we created a program that provided $10,000 of grants. These weren't loans, these were grants with a very simplified, straightforward application, knowing that $10,000 wasn't going to necessarily solve all of the issues, but it allowed them to cover employee expenses, other requirements to keep the doors open. So that was one instance, and that $1 million was leveraged, and other corporations started expressing interest in being able to do that. So that was one notion, because those bodegas and small mom and pop businesses are so essential to keeping the neighborhoods intact and providing goods and services that are needed at all times, but particularly in the middle of a pandemic.
Jay, this is Ana Mari over from HIP. We did the same thing with the Power Up Fund, which launched in June, and the Power Up Fund it was $3.5 million that we put into the hands of small businesses, bodega owners, entrepreneurs, taquerias, beauty parlors, and that was straight cash assistance as well. And many of them also were able to have wraparound coaching and support from, for example, Alapara CDC in Miami, Eureka, which is run by our dear friend Melissa Bradley. So they were able to also have mentors. We're hoping to do a next round next year, but the Power Up Fund is .org is on our website, and folks can check that out as well.
Two questions from the chat. Again, these are questions from participants, so I want to make sure that we're getting to those, and there's some similarity. Dahlia asked about sharing more about deciding to have the state administer cash relief. How do you ensure confidentiality, safety for undocumented families and get families to trust accepting a cash assistance from the state after Trump administration has eroded such trust? And then a similar question around trust from Edith. Again, how do you establish trust with undocumented workers to feel safe to accept state? So that trust in getting those families who have been for, well before this administration, but certainly with this administration, targeted and the erosion of that trust. How do you go about establishing and maintaining that level of trust to get the assistance where it's most needed?
So I think it's a great question, because I realize that, and there are other states where nonprofit organizations and community-based organizations made the opposite choice and really decided to have it go through nonprofit sector and other community-based organizations. And so I think that one, we want, there's a sort of a strategy behind it here in the state of New Mexico, right? Which is to, we have a governor that will be here for at least another 2 years, maybe another 6. We have a new legislature. There are a lot of political issues as well going on as power building organizations that we're thinking through about how we can continue to make how to continue to institutionalize some of the protections that we already have in place at different agencies, and how, again, we can continue to work with government to be more responsive to our communities, because again, as we like to say, hashtag, it's our money, we pay taxes. And so we shouldn't be left out. And it gives us opportunities to continue to organize around, again, lifting some of those horrible restrictions that people kind of took for granted in the past. And so there's that. But I think that the real way is when government and philanthropy work with community-based partners. And so just last night, our 5 organizations that are a part of the economic relief, the statewide economic relief working group, we're all community-based, and we're in both rural and urban communities. We have a very broad, between all of us, geographic scope. And so we partnered with our state and our human services department yesterday to do a Facebook Live, our logos. And so people trust our organizations. And so that's why it's so important that we're creating these kinds of partnerships. I say that because that's the reality of New Mexico, knowing that that's not always the reality in other communities. And so in some of our cities and counties, our local governments want to have nothing to do with Somos un Pueblo Unido. And so that's why it actually allows us a little more leverage at the state level to help our state officials understand, look, it's great that you're covering and supporting work in these urban areas. But what about these rural communities where essential workers, particularly immigrant workers, are key to key industries in our state, agriculture, oil and gas, as well as others. And so it was a strategic decision, but also it's the partnership with the community-based organizations that have the trust of the community. And I know none of that is new to all of your philanthropic partners on this call. It's the best. Obviously, we think it's the best way to be able to do some of the good government programs that we are embracing and that we're pushing forward.
I agree. Oh, go ahead, Heiny.
Fuerza Laboral, that is a community organizing. Our members, our goal is to change our community. So we are community organizer. We need that. We don't do that job alone. We put in practice our mobilization, our member, voluntary, building relationship with across our history in organization with the government and non-government organization, private and public sector, create support the network. And we ask the people, the resource they use for our knowledge about pass that information to our community and support money, assistance, health information, everything. That was our job in this pandemic.
I agree with Marcela and Heiny that the community trust is huge in this and necessary, and that's why this leadership and the funding for organizations like theirs is so important. And some of the practices that we've seen to help establish the trust has been incredible, where organizations have partnered with community banks to issue cash cards, no questions asked, no documentation asked, where traditionally they are asking for ID numbers or social security numbers, and that has been a huge shift. And we worked with the Poder card that was also doing the same thing at a national level and setting up bank cards without cost for a lot of different organizations. And we also know that bank cards can't pay for utilities and rent. And in Omaha and in Florida and in a lot of different locations where there are rural communities that are hard to reach, organizations have actually been issuing cash like dollars as opposed to bank cards. And some of this has been in partnership with local officials that are helping them get to hard to reach places, understanding also the dangers of issuing cash, but doing it because of the need and foregoing a lot of the like data collection and restrictions that traditionally exist in order to meet that need. And I think that has been incredible practice, and we definitely hope to see that continue to move forward.
Let me, if I can, Meg, you talked about, I was, fascinated the fact that Blue Meridian represents an amalgamation of a broad spectrum of philanthropists, both family, individual philanthropists who, are looking to target programs that work. Does this serve as a model that could be even brought to greater scale? And how is it that Blue Meridian has cast a view, or are there opportunities for other innovative type approaches to perhaps come onto the radar screen of Blue Meridian? How does that work in terms of the things that they both identify or would be willing to entertain?
Yeah, I think we're always looking for new opportunities. It's an ongoing sourcing, and we've been really focused on what are the lessons we are learning from this immediate response. I think similar to what other folks have been saying, I think in April when we launched this fund, we thought, oh, 3 months of immediate need, which is obviously not the situation that we're in. And so we're thinking about how does this work inform our longer term work, right? So as we think about solutions to this broad discussion about government funding and the racist ways in which our systems are currently structured, we're thinking about what are deeper investments we might make in that sector, right? Understanding that public benefits represent a pretty significant solution out of poverty for many families, right? So I think we continue to look at opportunities over time of, what are we learning along this process? I think we've learned a lot from the cash assistance efforts across communities that's informing how we think about what are our next generations of more sizable investments in our more traditional model.
Thank you. And along those lines, I'll open this question up to any of the panelists. What are some of the things that you have learned now that you would do differently? Again, hindsight is a beautiful thing. It gives us the ability to sort of, look back and learn. But I think silver lining here, if there is a silver lining, is that we still have some ways to go before we find ourselves clear of this pandemic. Even with the welcome announcement of the vaccines beginning to roll out, the vaccination isn't going to happen overnight, and there are still going to be precautions that need to be taken, and the lingering effects of COVID will still be with us. So we're sort of in the middle of this, maybe headed toward the end, but what are some of the things that we can apply as we go into 2021, and certainly the first 6 months of 2021 are going to look a lot like the previous 3 or 4 or 5 or 6 months. So are there things that we can learn that we can put into action in real time for this crisis, and certainly for the next crisis? Hopefully it won't be a global pandemic, dual global pandemics, but things that we can put in practice real time and we can carry forward lessons.
This is Dolores, Alma Health Foundation, and there's actually a number of things that we've learned. I'll just speak to 2 very quickly. One is the importance of not just short-term immediate relief, but simultaneously focusing on long-term equitable recovery. That's critical. Secondly, is that we need to do a better job, and I'm speaking for Alma, but I encourage my colleague funders to think about the same. We need to do a better job of using some of the strategies that we're using now for this pandemic, such as changing some of our processes regarding due diligence, and keeping some of those. We really have to have a very hard look at some of our practices and really consider changing them for the future, looking at more things that we've heard from our nonprofit partners year after year, doing multi-year grants, doing more in terms of general operating, less project support, requiring less in terms of reporting and just getting the reporting that's critical to what we need, on and on and on. We plan at Alma to continue those measures going forward and really trusting and relying on our nonprofit partners, and that's what they are. They're our partners, to do and to use the resources in the way that is most needed.
Others, everything you said, Dolores, almost verbatim, are things that we are taking heed to at the Hartford Foundation. I couldn't have said it better. Others?
I think I completely agree, and to add to that, I mean, for us, it was critical that we could make sure that the organizations that were doing the most important work were also the organizations that didn't have development directors that could submit fancy applications, and oftentimes there were folks who also needed us to provide support in Spanish to get information to us so that they could apply. And so we offered folks the ability to provide a proposal through a voice message. The same with the reporting. I think these are great practices that can continue in the future. We also expanded the understanding of how do you provide direct cash assistance, and what are the ways that assistance is being given in order to support workers. And you know, one of the things that we saw and continue to see is the very, very high rates of domestic violence, and the challenges that women specifically are facing in this moment, where a lot of women are leaving the workforce, and basically choosing, you know, a house over my head, care for my children, and health. And then none of those, they're not exclusive of each other, right? Especially when you're caring for young children as a single head of household, as a woman. And so I think that understanding how we see the ecosystem of support in moments like this, and looking to be able to provide assistance for organizations so that they can have that agility and flexibility is essential. And I just will say once again, the operational support, so that organizations are not doing this at a great deficit to themselves, when they themselves, especially the organizations we're supporting, are part of the community, are being impacted by these rates of COVID, are working in silos, and with all of the restrictions that the shelter in place create for organizations. And so that flexibility, I think, continues to be important as we move forward in our fund.
Simple.
We have about 3 minutes, 2 or 3 minutes left. Certainly want to, you know, lessons learned, things that we can share as we begin to wind down this portion, and I'll turn this back over, but by all means, Heiny.
Yes, simple. We are supporting and emphatic with the people. The idea is the raise awareness. We are not alone. There are help when we help. That's very important at our grant of thanks. The strength is the union. That's it.
Marcela?
Just quickly, and I know it's mostly a question for foundations, but even or for the funders, that investment in power building organizations, community organizations. I mean, most of the organizations doing this work at sort of at this level, also we're doing census work. We're also doing, during the pandemic, we're also doing electoral work, both with our C3s as well as our C4s. And one of the things that, with a lot of our local and statewide policy making, but this has really made it clear to us as community organizations, as we continue to do that power building work, is, you know, there's a big push right now for candidate recruitment, for instance, which is great. You know, we just had a really interesting election here in New Mexico, and we saw some political shifts in our Senate, et cetera, but not to get bogged down in the politics. One of the things that we also have been realizing through this process is how important it is to recruit people to work, good people, smart, good people of color, people who are visionary, to work in government, to work in these agencies. We were talking just on a call the other day how, you know, a city attorney can make it or break it for us. And so recruiting good people, and I always make the pitch for good folks in philanthropy, because sometimes these are the most visionary people I know, is we need to recruit people to work in governments, because it really was a major, we could get some of this stuff done the way that we wanted to be able to get it done, really meeting the needs of people on the ground, because we had bureaucrats, agency heads saying yes instead of no. I don't know how to do this yet, but we'll figure it out. And so anyway, that's just one lesson that we've been really teasing out here in New Mexico.
Thank you. Olga, you will have the last word of this segment.
Yeah, in our case, as a direct service organization, one of the lessons that we got from this situation is that we have to always challenge the assumption, because it's assumed that our people, which in our population is 90% under poverty levels. So people assume that they're gonna get support for food, for finances, for health, and that is not necessarily true, because they cannot have access, when 70% do not have connectivity services. So in our case is to make sure that we challenge that assumption that the help is actually being directed to the communities, and take it on ourselves, and then battle against the conception of we're only educational services, and prove and show that we're able to really advance the work of the government and the philanthropic organizations.
Well, thank you all. We do have just a couple more minutes. If each of you want to make a closing comment, I would ask that you would keep it succinct. Everything that you have shared has been so impactful, so compelling. This session is being recorded, and the folks at HIP can talk to us about how it would be used. But if you'd like to make a closing comment before we turn it back over to Hilda, I will open the floor.
I would like to add that, what's something that is important to us, and I think even more important, is the multi-sector approach. It's like the example of the three-legged stool, where one leg is government or public, one leg is private business, and one is the philanthropic and nonprofit sector. And it takes all three legs to support this table of community. No one sector can do it by itself. And I think the example and the work that Marcela gave in terms of the public-private collaboration is a really good one, but it's something that we'll continue to pursue.
Thank you.
I would just wanted, in addition to Dolores, I think for us, it's really important to see this moment, like what you started, Jay, that this isn't just a pandemic, but this is also a moment of racial reckoning, and it isn't a mistake. I think that both are happening at the same time. The disparities we're seeing in our communities are because of the systemic issues, and Meg also, you mentioned this, and so how do we build alliances, build power together to transform, use this moment fully for transformation, so we don't see another pandemic that is almost looks genocidal in terms of the numbers that are impacting our communities, Black, Brown, Indigenous communities.
Thank you. Because there will be another crisis. We just, we don't know when, we don't know where. We certainly hope it isn't of this magnitude, but there will invariably be another crisis. And how do we not have data that demonstrates, and you put it so powerfully, almost genocidal data that just demonstrates communities of color being eroded and attacked in ways that are just unconscionable.
And in addition to knowing that there'll be another crisis, we also know that there are systemic structural issues now that won't go away. Another issue that we're working on is broadband, what I call the digital divide. That has really come to the forefront because of COVID. We're working on that now.
There's no app for that, and there's no vaccine for that. There's no vaccine for racism. When that vaccine is developed, then we will all be better off as a society. But until then, our work remains ever so essential. So again, thank you all for everything that you have done prior to these dual pandemics converging. Thank you for everything that you've done in the midst of these pandemics, and everything that you will continue to do as we move to challenge the issues that face us and take advantage of the opportunities as we turn the page on a new year. So thank you all. We certainly appreciate it. And I turn this back over to Hilda.
Thank you so much, Jay, and thank you everyone for your amazing work and your thoughtful comments, and for sharing everything that you've been doing over the course of some very difficult months. Before we close out, I did want to just share a resource, since we were just talking right now a little bit about data, and I wanted to let folks see a mapping project that HIP engaged in over the course of this year, and hopefully folks can see all of this. So at the beginning of the pandemic, I think we were all in a position where we were trying to figure out how was COVID really impacting our communities? Where is the data coming from? Why isn't data disaggregated? And so HIP began working on a mapping project to be able to really help us understand how COVID was spreading and impacting different Latino communities. We also extended the map into Latin America so that we could see how COVID was impacting communities across the entire region. And then what we were also able to do was collect stories from some folks who are on the call today, from different folks who are part of the Essential Fund, and from a variety of partners who were impacted in different ways by COVID and were part of different funds that we managed in response across the Americas. So if folks are interested and want to take a peek through the maps or hear these really fantastic collections of stories, they can go to COVID-19impactdisparity.org, which you can see up on the screen. And just a little note on the maps, for example, these maps represent information that is being reported by a variety of government sources. So what you see is kind of what we know and what is available. For example, these Black states here are states where there isn't any reporting. But when you can go to a state like my home state here in Illinois and you can click through, you can see how COVID has impacted our Latinx populations in terms of percentages, cases per 1,000, mortality as well. And likewise, you can zoom out and you can get a bigger sense of what's happening across the whole. And you can also see in some cases what is happening in Latin America. But again, the data really depends on how governments are reporting. So we invite everyone to take a look, see how the data is impacting our communities in different ways, and over time, the data is updated at least once a week. And so we're really happy to have folks use this resource. Let us know how it's working for you. We'd love to hear any comments or suggestions you have in terms of making sure that we are a resource for people who want to continue to spotlight the impacts of COVID on our populations. And we look forward to hearing any thoughts from you on that. And also want to thank our communications team and the folks that we worked with here in the US, Graffiti and Racismo MX in Mexico, to bring all of this data to you all. Otherwise, I just want to take a moment to thank everyone for joining us today, to thank the HIP staff who work on the Essential Fund and our consultant, Ana Avedaño, who many of you have met throughout the course of this work. Thank our communications team, as always, for helping us get the word out and have folks join us today. We look forward to being able to share this recording with everyone who signed up. And of course, you can disseminate that and share it as you like. We will also link any resources that might have been mentioned or other pieces that folks who were on the call today want to share out with everyone. And we look forward to having you join us on more webinars and conversations next year. But for now, I want to say thanks and wish everyone a really beautiful holiday season.